at the 46th National Conference of Speech and Hearing Association, ISHACON 2014. We have with us Dr. Premjith G, who has done his PhD in audiology and speech pathology. He is also the organizing secretary of ISHACON 2014. Let's welcome him to the show. Hello, doctor. As you are specialized in audiology and speech pathology, we would like to know what exactly is speech pathology and audiology.
Speech pathology and audiology basically deals with disorders of speech and hearing. So, the professional as such deals with the assessment of speech and hearing disorders as well as the management of speech and hearing disorders.
And what are the main causes for this defect?
There are wide variety of causes and there are wide variety of disorders, starting with genetic issues. Then you will have congenital problems of speech and hearing. Then there are a lot of acquired causes like infections or different wide variety of conditions can lead to speech and hearing disorders.
Is it a birth defect or does it occur due to the living conditions?
Yeah, there are both. Lot of speech and hearing disorders comes as a birth defect. For example, if the genes involved with hearing is affected, that will lead to the birth of a child with congenital hearing impairment. Similarly, if the brain is impaired, say due to mental retardation, that child, when it develops, will definitely have speech and language impairments. Same is the case with a child with hearing impairment. He will also have speech and language difficulties. So, there are a lot of conditions that can lead to congenital, or when the child is born, that time the child will have speech and hearing disorders. Basically, a child with hearing impairment or any kind of brain abnormalities, all these can lead to speech and language problems. So, speech and hearing both are so much interconnected that problem in one domain will invariably lead to the impairment in the other region also.
How early can a parent detect that their child is affected by this speech and hearing ailment?
There are normal developmental patterns for speech and language development. By say 6 months of age, the child will start producing some sounds, and normally a normally developing child should be starting words by around 1 year. By around 1.5 years, he or the child should be producing say 2 words together. After that, the length of sentences will slowly increase. So, if the normal course of development is not seen in a child, say he is not coming out with a word by 1 year, he is not coming out with any word by 1.5 years, all these are very clear indications of speech and language impairments. So, the parents should carefully monitor the child, see whether the child is developing like a normal child, whether the child is developing speech and language at these say so-called normal acquisition ages. If they have the slightest of doubt, at the earliest they should take the child to a speech pathologist and audiologist so that they can have the evaluation at an early stage and they can do the treatment. Similarly, the same is the case with hearing impairment also. Nowadays, there are a lot of screening programs available. Say when the child is born, before the child gets discharged from the hospital, say within a period of 1 or 2 weeks, you can have a basic screening done. And if the child fails in that screening, you can take the child for a detailed assessment. So, why early identification is important is the speech and language or the language development is very vital during the first 4 years of life. So, that is a critical age for language development, the first 4 years of life. So the early you diagnose a child with a condition, you can start with the treatment early. If you are not diagnosing the condition, say by 4 years of age, it's very difficult to give treatment to the child. The normal language or the language development goes up to 7 years of age. So if we are missing that first up to 4 or up to 7 years of age, we are not doing any kind of treatment. Then after that, it is very difficult for the child to develop language, even if you provide any amount of treatment. So that is very critical, early identification. At the earliest, if you can identify, you can go for the treatment, and that much the child will improve as far as language or speech is concerned.
What about hearing defects, sir?
Hearing defects also, like there are screening programs available, like actually all the childs should be screened for, they should just go for a routine screening for hearing capacity. If they fail in that screening test, they should definitely go for a detailed assessment and ensure that their structures and functions related to hearing is intact. Otherwise, you can go for treatment options like hearing aids or cochlear implants at an early age. The earlier you go for such options, the better will be the treatment outcome.
What are the basic treatments that you can provide for the child suffering from speech defect?
So the treatment will mainly focus on, say, if the muscles are weak, the treatment will focus on strengthening the musculature. If the child is not producing the sounds correctly, then the treatment will focus on teaching the child how to produce the sounds correctly by showing the correct manner and place of articulation. So depending upon the disorder, the treatment will vary. On the other hand, if the child is having a language disorder, say for example, a child with hearing loss, if the child is having hearing loss, he will not be able to hear the environmental sounds, he will not be able to hear anything from the world. If he is not hearing anything, his brain will not have the language developed. So that will definitely affect in his output. He will not be producing any words because there is nothing in his brain. So the treatment of that, first you have to identify what is the cause of the language impairment. If it's a hearing problem, you have to go for the treatment option for treating hearing loss first. Say go for a hearing aid or go for a cochlear implant. Then you have to teach the child the language aspects. Okay, whenever the moment you are fitting the child with a hearing aid or an implant, then you have to start giving speech or language training to the child. All these things, on the other hand, if the child is having, say, mental retardation because of the inadequate brain functioning, the language is not developed. In such a case, the treatment is, the strategy is different. You have to provide more training to the child, you have to teach the child more specifically about the different structures in the language. That aspect is totally different. So the most important thing is identify what is the cause that leads to speech or language impairment, or identify the cause leading to hearing loss. Then depending upon the cause, you modify your treatment.
What are the latest advanced technologies which will help us in treating these children?
Yeah, there are a lot of the technological advancements are coming at a fast pace in this field as well. Hearing aids, if you take the case of hearing aids, there are lot of technological advancements that has come in. The main focus will be to deliver high quality of sound to the child. Even if the child is having, say, profound degree of hearing loss, there are very powerful hearing aids that if you fit, that will be helping to deliver the right kind of information to the child. Similarly, if the impairment is beyond a level where hearing aids will not be of much help, in such case, there are options available like cochlear implants, there are options available like brainstem implants. So you can go for all these kind of things, and then the treatment or the long-term management of speech and language development can occur after that. Yeah.
What does a cochlear implant exactly mean?
So it's a surgical procedure wherein there are some cells inside the ear that is supposed to function for hearing. If the cells are damaged, what you are going to do is, instead of those cells, you will insert electrodes inside the ear, say inside the cochlea. So after surgically inserting those electrodes, there will be a processor outside that will be outside the skull. So that processor will capture all the sounds in the environment, and it will be electromagnetically fed to the electrodes. So from there, electrodes will pick up these signals and it will be electrically transmitted to the nerve. From there, the nerve will take it to the brain. So this is the mechanism. Similarly, for brainstem implant also, you will be inserting at the level of brainstem. So the mechanism is same. Okay, it's a different type of signal. If the normal functioning structures are not functioning, you are substituting those with electrodes.
What is the role of audiologist in cochlear implantation?
Related to implantation, the role of audiologist starts in determining the correct candidate for implant. There are a lot of assessment methods to detect what exactly is causing the hearing impairment, where exactly is the problem, how severe is the problem, whether it can be treated medically, surgically, or say by means of hearing aids. All these things you have to rule out. If these options are not available, then you can put the candidate for an implant. So identifying the correct candidate is the role of an audiologist. Okay. Then the next role comes is the surgery will be performed by an ENT or a neurologist. Okay. So while performing the surgery, it is the role of the audiologist to check whether the inserted electrodes are functioning properly. Okay. That is the role of the audiologist at the time of operation. So ensuring the proper functioning of the electrodes, once that is done, then the next role comes after the surgery. After the surgery, you have to switch on the implant, you have to do a proper mapping where you program the implant. So all this comes under the domain of the audiologist. From there on, teaching the child, say each or making the child to hear with the implant, that is again the role of the audiologist and speech pathologist, wherein they will be training the child on, say, auditory verbal therapy or each and every minute things, because a child will be hearing for the first time in his life. So you have to teach each and every sounds. You have to make the child to understand the awareness of the sound. A sound is present. Then you have to teach him to discriminate between say low frequency sounds and high frequency sounds. There are different steps involved. So after the surgery, it is the role of the audiologist and speech pathologist to make the child to hear through the implant and to teach him to speak.
Does speech problems or speech disorders occur due to accidents?
Definitely, because in the brain there are specific areas for understanding language. There are specific areas for producing language or speech. So if any of these areas are affected, say due to accident, okay, what will happen is the function of those areas will be affected. Once that is affected, that will get reflected as a speech impairment. You have to first diagnose what is the condition. Due to accident, which area is functionally impaired. After diagnosing that condition, you have specific treatment strategies for treating that condition. Then you have to go ahead with the treatment of that.
So, when a person has met with an accident and he has lost his speech and hearing ability, what are the basic training or treatment which an audiologist can give?
Due to accident, impairment of speech, okay, as I said, you have to diagnose exactly which region is functionally impaired. If some region is affected, say due to accident, due to reduced blood supply to that region, if that region is affected, you have to give training so that the functions of those areas are regained. You have to focus on that. If you are not able to regain function of those structures, you have to motivate or try to make the surrounding regions take up the function of the affected region. Okay, say for example, if mainly the left hemisphere is involved in producing speech for right-handers. So if a person has an accident and if his left hemisphere is affected, you have an intact similar structures on the right hemisphere. So your treatment options will focus on activating the right hemisphere to take up the speech. So all these things depends upon which area is affected. Similarly, for hearing impairment, you have to check what is the functional impairment for that person, whether the central auditory processing is affected, whether the brain centers concerned with hearing is involved. If that is the case, you have to go for the management of or you have to give training for improving the auditory processing aspects per se.
Is there any chance that other areas or other problems occur due to speech disorders?
Other problems in the sense, if a person has speech impairment, it affects that person in all walks of life. Okay, one, his communication is affected. Once his communication is affected, he will not be able to mingle in the society. That will affect the person's social interactions. There will be an influence on his emotional aspects, his confidence, output of the person as such on the entire thing, because once communication is impaired, the chances that it will affect in different ways of life. His education aspects, say his professional aspects, all these things will have indirect effect.
We usually hear that the hearing abilities of diabetic patients reduce during ongoing years. So why is this happening?
Yeah, diabetes as such, it will have effect on the functioning of the cells inside the cochlea. It will have bearing on the functioning of the nerve, auditory nerve. So the pathophysiology related to diabetes mainly occur at the level of hair cells of the cochlea as well as the functioning of the auditory nerve. So what happens is, over the years, these cells and the nerve functioning can slowly get degraded, and your severity of the hearing impairment can also worsen over the years.
It is said that due to the exposure of high ultraviolet sound or high sound, there will be hearing disabilities. Why is it so, and how can it be treated?
See, there are two types of damage that can happen due to sound. One is acoustic trauma. Suddenly you get exposed to a blast, okay, say bomb blast or any kind of firecrackers, anything like that. So it can affect the hearing system in two ways. One is your tympanic membrane can get ruptured. Other one, your inside structures, say hair cells, the function can get damaged. That is one. Another one, long-term exposure to loud noise. Okay, people working in factories, exposed to long hours of noise every day. So over a period of time, what will happen is these cells will get fatigued. Okay. So initially there could be a temporary damage of the cells, and once you give rest, it will regain its function. But if it is prolonged for years together, that will lead to a permanent damage.
The hearing abilities of diabetic patients, as you said, it will reduce during the years. So later on, will it affect their speech impairment, or, I mean speech ability also?
Generally, it doesn't affect. Okay, why? One, because if generally if it is an adult patient with diabetes, he would have acquired all his speech and language skills, he would have been speaking normally. So a deterioration in hearing, but if it persists for long years and if the impairment is severe and if he is not going for any kind of say treatment options like hearing aids, what will happen is he will not be hearing what he speaks or what others speak. So it will have an indirect influence on the clarity of his speech. So over the years, if he is not going for any treatment for hearing loss, it will affect the clarity of his speech output.
What will be the basic training or exercise which is given to a person who has lost his hearing and speech abilities by birth, and what will be the difference of the treatment given to a person who has lost his speech and hearing ability after like around the age of 45 years due to an accident or brain stroke?
See, both are different conditions. Okay. One is a congenital or early onset condition leading to speech and hearing impairments. There the primary focus will be on early identification one. Okay. And you have to decide what line of treatment you are going, and it should be a steady line of treatment wherein you will be working on the say goals that the child is supposed to achieve during a period of say 6 months, 1 year, 1.5 years. Okay, you will be focusing your goals that way. It will be a steady and continuous way of treatment. The other one, it's a acute case. Okay, a person suddenly losing speech or hearing after an accident. There the line of management comes. Before the line of management, you have to diagnose where exactly, what exactly is the pathophysiology leading to the condition, what is the exact condition, and say if the speech is or language is affected after a accident. Normally the brain structures, once if some damage occurs, there is a tendency that within a period of say 3 months or 6 months, the structures have a natural tendency to regain its function. So you have to capitalize that period. So it should be very intense, focused management to such people during the first 6 months of after the accident. So chances of improvement that comes along with treatment is very fast, or that is this period is most critical. So once you pass that period, say 6 months or 1 year, and once the structures are settling down with the thing, there will not be much prognostic thing with the treatment. So it should be a focused, very intense training or treatment during the first few months. Yeah.
In congenital cases, will it directly affect any chromosomal defect? Will it lead to any chromosomal defect or any other defect?
See, congenital cases, there is a specific gene involved with hearing. Okay, its name is connexin 26. So it is found that if the gene is affected, that will lead to the birth of a child with hearing impairment. That gene is found responsible for hearing. The gene is impaired, that can lead to a hearing impairment. Yeah.
Okay, and if a parent is affected with this, if he or she is affected with a hearing or speech disability, will it affect the child?
Of course, it is a predisposing factor for a child to develop its speech and hearing complaints. If the parents are having such a complaint, there are evidences, there are research which has shown that for the future children also, their children also can have speech and language or hearing complaints. So stuttering is also found to have a genetic predisposition. So when we take history itself, that is one of the most important questions that we ask, whether the parents, any one of the parents or the family has a hearing impairment or a speech and language impairment.
How can we correct if it is a genetical defect or if it is due to the genetical person?
See, whether it is genetical or whatever be the cause, while assessing, we will be assessing what is the exact pathophysiology, that is like how the structures are affected, how the cells are affected, how the nerves are affected, and how severe is the condition. So once diagnosing that, you decide the line of treatment. Okay?
Thank you, sir. Thank you for spending your valuable time with us.
Thank you very much. I wish all the best for Medibiz TV.